Good evening and welcome to After the Bell, the show where we track all the top stories after the markets close in CNBC TV 18's Mumbai News Centre. I'm Abhimanyu Radhakrishnan. Sandeep Gurumurthy there joining us from Delhi. Now, the business of testing experimental drugs, or clinical research as it's called, is set to cross $1.5 billion as an industry by 2010. But the Indian industry is facing a crunch for trained manpower, and that's where international associations are chipping in, as Vikas Dandekar reports from Pune.
There is a need to build the capacity.
That statement from India's drug controller, Dr. M. Venkateshwarlu, points at the yawning gap between the booming clinical research business in India and the need for trained investigators. According to industry studies, the market for clinical research is expected to reach $1.5 billion by 2010, but the shortage of trained clinical research professionals could be a deterrent.
The deficit by 2012, which McKinsey has been able to establish, is 50,000 in Asia alone. We plan to, by 2010, build around 5,000 students of a top-notch capability.
Bilcare, which has presence in specialized packaging for the pharma industry, has tied up with the Association of Clinical Research Professionals to bring in trained manpower to conduct clinical research. With MNCs looking at cutting costs and curtailing the time to market their drugs, India is attracting more and more projects.
That there's so many studies now that are out there, and we're looking for more places to do them, more people who have not ever been able to participate in a study, and India presents a lot of those types of opportunities.
Hundreds of CROs have cropped up in India in the last few years, but many could not build the right reputation. Bilcare's association with ACRP is expected to produce good quality investigators who can do quality clinical trials. In Pune, Vikas Dandekar.
So wrap on this edition of After the Bell. Thanks for watching. Stay tuned for more news.